Hi there, I'm Dr. Sue Cancer Vet. Welcome back to my video. This is part 2 of the different chemotherapy protocol options for dogs with lymphoma. If you missed part 1, be sure to watch that where I go through why we use chemotherapy for dogs with lymphoma and the best chemotherapy protocol, which is the CHOP multi-agent chemotherapy protocol. But what if you're looking for something that's a little bit less expensive or something that will require less frequent visits to the veterinarian? Well, then you've come to the right video, and in this video we're going to break down the different alternative chemotherapy protocol options. The good thing about lymphoma, if there is a good thing, is a couple things. Remember, and I talk about this in part 1 and in lots of my other videos in the chemotherapy playlist, is chemotherapy is extremely well tolerated, so please check out those videos. The other thing is there's a lot of different options, and that's why I broke this into 2 videos. So again, don't forget to check out part 1, but there's lots of different options. So let's do it. Let's talk about some of the different alternative chemotherapy options for dogs with lymphoma. All right, so what if you don't want to do the CHOP multi-agent chemotherapy protocol and your dog has B-cell lymphoma? What is the next best protocol? So then we're going to usually a single agent protocol. The next best one traditionally has been single agent doxorubicin. I mentioned in the intro that that does have a side effect of cardiotoxicity with certain heart conditions. So arrhythmias, abnormal heart rhythms, and dilated cardiomyopathy. It's fine in some dogs like with heart murmurs and things like that. So that is the second best protocol. That usually has lower remission rates, but still pretty respectable, about 60 to 80%, and usually median survival times about 7 to 9 months as opposed to that 13 to 14 months. It's given about every 3 weeks, and we max out at about 6 doses of chemotherapy because that's when we start to see the heart issues. The heart issues are uncommon in most dogs, and they may have, your oncologist or your veterinarian may recommend some sort of heart baseline evaluation, like something called a fractional shortening, which is a non-invasive test done with an ultrasound probe or maybe an EKG. So if that is usually considered the second best protocol. They're only coming in every 3 weeks. It's it only 6 doses, so it takes about 4.5 months to do. Recently, Genovia is a new drug that came out on the market. It's labeled also for every 3 weeks for 5 doses, and that had similar response rates in the initial studies. There were relapsed dogs and newly diagnosed dogs, but then a follow-up study came out with newly diagnosed lymphoma dogs alternating Genovia with Doxorubicin. A little bit more expensive than single agent Doxorubicin, but a little bit better response rates. So that is now something, if the owners can, after we go through the estimate, that is now my second Plan B protocol for dogs with B-cell lymphoma. So if they can't do CHOP, they can't come in weekly, can't afford it, I'll talk to them either about doing single agent Doxorubicin or alternating Doxorubicin with Genovia. I think that's a great option. What if we're dealing with heart issues? You could do single agent Genovia for 5 doses. Another option would be the COP protocol. Sounds really similar to the CHOP protocol, right? So you're taking out the doxorubicin. So that would be another potential good protocol for a dog that has heart issues. The problem with the COP protocol is it's a maintenance protocol that usually goes for a year. A little less expensive, but by the time you get to the year, they're getting vincristine and cyclophosphamide maintenance every 3 weeks. So it's another option. If you've watched some of my other videos, I did that as a maintenance protocol for Ms. Pokey. So if you watch my Can We Cure Lymphoma video, I'll put the link below. I use that as a maintenance protocol. So not one of my first line protocols, but it definitely has a use for certain dogs. So that would be another good option. If you're looking for a less expensive protocol than all of those and you still want to do some form of chemo, sometimes we'll end up doing oral Lomustine every 3 weeks for dogs with B-cell lymphoma. For Genovia, about 70 to 80 overall response rate. And then the combination of Genovia and Doxorubicin was about 84%. So that's why I like it better than just single agent Doxorubicin. And in general, again, I like multi-agent protocols better than single agent. COP as a single, as a protocol, about 70% response rate, and the median survival time is about 7 months. So not as good as the other ones that I mentioned, but again, for a dog with heart issues, might be a good option. So again, back to oral Lomustine. This is usually one that I'll use for dogs with T-Cell lymphoma, but it's less expensive than the other Plan B, Plan C protocols for dogs with B-cell. So sometimes you can do it for B-cell, but there's not, I'll be honest, a lot of published data using it as a first-line protocol, and the published data is meh. I'll be honest, it's about a 35 to 40% response rate. Not as good as the numbers I've been quoting, and a median survival time of about 4 months. So not great. It was a small study, about 20 dogs if I remember correctly, and they were also on steroids. So I've seen some better responses for sure. And you have to remember, we'll always see ranges, and I'm sure somebody's gonna type in like, I did that with my dog and we did much better, and that's great. So there's just not a lot of published data to really share, but I definitely think it's better than just doing steroids, so I will do that. Again, we have to check the liver values with that. So there's always things that we, special toxicities that we sometimes have to consider, and that's why I can't make recommendations for your specific dog. This is supposed to just be a good overview. Okay? All right, so now let's talk about dogs with T-cell lymphoma. Not every oncologist treats dogs with T-cell lymphoma the same. Most of us probably treat dogs with B-cell lymphoma with a University of Wisconsin CHOP protocol or something really, really similar, depending maybe on where they were trained. With T-cell, some oncologists, some of my colleagues, some of my friends will still use the CHOP protocol. I don't, because we know that those dogs usually don't live as long. Instead of the 13 to 14 months, it's about 8 to 10 months, and they just don't respond as well. And we know that they respond better with the Lomustine, but that's not a great single agent protocol. And we know that dogs with T-cell don't do as well with Doxorubicin. So what I've done, and what some of my other colleagues have done, is I pull out the Doxorubicin and I put Lomustine in the University of Wisconsin protocol. I usually stretch it out to the 25-week protocol. It's just the way that I like it. So it's the same drugs, it's just spread out a little bit differently, but they're still getting the same drugs at the same dosages. It's just every other week for the second half of the protocol. So that's what I do. I've had some dogs do phenomenally well, but that's personally what I do. Your oncologist may still want to do the CHOP chemotherapy protocol, so just talk to your oncologist and weigh the pros and the cons. Lomustine can have liver issues. I will put them on a liver supplement as well when they're going through that. Sometimes we have to delay the Lomustine. What if you don't want to do a multi-agent chemotherapy protocol for a dog with T-cell lymphoma? I'm not going to do Doxorubicin, definitely not. So that's the reason we wanted to do that phenotype. It, not only was it prognostic, but it allows me to make chemotherapy treatment recommendations. I would do Lomustine. Since they don't do as great with just Lomustine, often I'll do Lomustine with vincristine. So there's not a lot of great published protocols out there. You can use Genovia as well. It works as well. So Genovia has only been on the market for about 2 years at this point. So we're still learning about it. There's a great number of studies from Vet DC, cutaneous lymphomas, multiple myelomas. There's a study in cats as well. So it's not, you can't use it in those because it's not approved for those, but they are doing their homework and doing a lot of clinical trials. So definitely, tune in here. I will be updating you as soon as we get more information about those different studies on Genovia. So I'm really excited about that. So again, for a dog with T-cell lymphoma, I'm going to do what I call a modified CHOP, take out the Doxorubicin, put in Lomustine, single agent Lomustine as a plan B, or maybe alternate it with some vincristine, maybe some Elspar in there as well. That's going to be what I'm going to do. A couple of other things that I do want to mention about Genovia since it's new. This is a veterinary chemotherapy. This is a product for dogs with lymphoma. A lot of the drugs that I've mentioned so far are human drugs that we've learned how to use and adapt for dogs and cats with chemo. It has some unique side effects. So the main one that it has, which is not so unique, is, GI side effects. So I'm super proactive with preventing anorexia and GI side effects. So I'm going to use Serenia and Entice. I found that most of my patients have tolerated it really, really well. The other thing is it's reported that it can have a weird skin side effect, and I've used it for a couple of years now, and I finally saw my first skin side effect with Sweet Sura, who's a beagle. She lost some hair on both ears, and that's unique to this drug. So that's something to kind of be on the lookout for. It can also rarely cause pulmonary fibrosis, and it would be against a label to be using this drug in Westies. Like I said, it can be really, really confusing. So I kind of just wanted to highlight the main chemotherapy protocols that we have, how I change the protocols for B versus T. But again, the things that you need to think about for your dog, for your family, when you're making these decisions is, how often can I get my dog into the clinic? What is my budget? How long of the chemotherapy protocol? And how aggressive, and I don't mean aggressive in a bad way, but the CHOP chemotherapy protocol, you're going to get the highest response rates. Your dog is most likely to live the longest. But, higher response rates, longer survival times. So you kind of get more bang for the buck. I hate to put it that way, and I wish that it wasn't that way. I love when clients say, I have pet insurance. I'm like, oh, awesome, because then we don't have to deal with the money part of it, because the pet insurance company is going to pay for it. And then we can really just make the decision based on how often they want to come there and what protocol is going to fit the dog's health, with their heart, their liver, and the other things like that. So I wish that the money was not part of it. But unfortunately, the reality is in veterinary medicine, usually the money is part of it. So you're going to need to get those estimates, figure out what your family budget is. I've had clients cancel their Disney vacation. That's their prerogative. They say this is an expense that we can live without. But other people, they're putting kids through college. So it gets really, really complicated. So how often can you get your pet to the clinic? How often do you want to go there? And how aggressively do you want to treat it? So those are the things that you need to think about as you're considering these protocols. Please remember that most clients that think that chemo is going to be horrible are really pleasantly surprised. So if you're thinking about it, give her a dose or two and see how they do. Please also remember to check out the chemotherapy safety video as well, how to deal with chemotherapy at home. Again, all of these videos are really important playlists. There's a lymphoma playlist and a chemotherapy playlist. But before we wrap it up, I really need to talk about prednisone, because that's really important. If you decide not to do chemotherapy, definitely do pred. So instead of that 1 month median survival time, we usually see about 2 to 3 months. But you don't want to start prednisone before chemotherapy, because it makes the chemo less effective. Please also watch, I have a 2-part video on steroids and things that you need to know. It's about steroids and cancer, but most of it's really about lymphoma because it's so important. So if your dog is going on the CHOP multi-agent chemotherapy protocol, they're going to be on pred for 4 weeks, and each week we taper and lower the dose, and then they're done with pred. And a lot of people hate pred. We lower the side effects. If they're having horrible pred side effects, we can taper it off. And actually, and I talk about this in the 2 steroid videos, there's a study that shows that dogs do okay without pred. I still really like pred in their protocol. But again, if you want more answers to your pred questions, that's another great video, because I go into a lot about steroids and cancer. But if you decide against chemo for your dog with lymphoma, that's okay, as long as you've made an educated decision. What sucks to me is a couple of things. When people start steroids and then they come see me and they want to do chemo, and I have to tell them that studies show that it could make their pet respond less favorably to chemo. It causes resistance. It causes something called multi-drug resistance. So you don't want to start steroids until you've absolutely eliminated the possibility. So if your dog's not eating when you're waiting for the lymphoma test to come back, the aspirates, get some Serenia, get some Entice. Don't use steroids to stimulate the appetite. So there are other things that we can do. The other bad thing about steroids is if you start steroids and you're on steroids, often other tests that I need to do like flow cytometry or ultrasound, you're starting to treat the cancer, it's gonna make those tests inaccurate. Watch that other video, guys. I explain more of that in there. I'm always happy if you tell me below, you know, we lived longer than the statistics. That nothing makes me happier. Sura, she lived longer. Pokey, Nettie, please watch my other lymphoma videos. I have other videos about can we cure lymphoma. I talk about Pokey. And then check out my vlog playlist. I always put in the title if there's lymphoma. You can see what it's like for dogs to get chemotherapy. So I hope you found this helpful. Thanks for watching. Please like, please subscribe. And I'll see you back at the next video. Thanks so much for watching.